Mr. Speaker, I rise today to recognize Women's Health Week and National Nurses Week. Yes, this week is Women's Health Week, a time to raise awareness about manageable steps women can take to improve their health. Currently, 1 in 5 women is in fair or poor health, and almost 40% report struggling with mental health issues. Women are less likely than men to be employed full-time, meaning they're less likely to be eligible for employer-based health benefits. Difficulty finding and maintaining employer-based coverage is especially pronounced for older women who are more likely to develop conditions like breast cancer. But thanks to Obamacare, women's health took a monumental step forward. Before Obamacare, insurance companies could discriminate against women, could deny coverage to women, of course to all people, due to pre-existing conditions such as cancer and even previous pregnancies. Today, becoming a woman or becoming pregnant is no longer a pre-existing condition. The National Women's Law Center estimates that insurers' practice of gender rating cost women about $1 billion a year before Obamacare. Obamacare ends gender rating. It requires health plans to cover women's preventive services like contraceptive care and OB/GYN visits without cost sharing. Accessible contraceptive coverage is particularly important because prior to Obamacare, more than half of all women between ages of 18 and 34 struggled to afford it. In addition, every health insurance plan is now required to offer maternity leave. Prior to the passage of Obamacare, the National Women's Law Center found that only 12% of private plans included maternity service. And even without those major improvements, healthcare accessibility remains a challenge. Almost 1 out of 3 women reports not visiting a doctor due to the cost. Women are still less likely to be insured than men, and even when they have insurance, women face increasingly high deductibles, co-payments, and other cost-sharing requirements, forcing major sacrifices just in order to make ends meet. A recent study found that over 40% of women have unmet medical needs due to the cost of medical care. This problem is particularly acute in states that have not expanded Medicaid. Currently, 3 million uninsured women live in states that have not expanded Medicaid coverage. So we have come so far in increasing access to affordable and adequate health care for women, but we still have a long way to go. This week is also National Nurses Week, and I can't pass up the chance to recognize the important contributions that nurses make, improving women's and men's health care each day. After all, we might not have Obamacare if it weren't for the support and advocacy of nurses all across the country. This year, National Nurses Week 2015 theme of ethical practice, quality care. And it recognizes the importance of ethics in nursing and acknowledges the strong commitment, compassion, and care nurses display in their practice of their profession. Registered nurses, RNs, are the largest segment of healthcare workforce with 3.1 million RNs, and that number is growing. RNs meet Americans' healthcare needs on every level. They provide preventive care, such as screenings and immunizations. They diagnose, treat, and help to manage chronic illness. And they help patients make critical health decisions every day. But most importantly, nurses take the time to care for each patient during a difficult time in their or their family's lives. And we have plenty of evidence that hiring more nurses leads directly to improved quality care and patient outcomes. We've seen study after study showing that this connection, including a recent analysis showing that 1 out of every 4 unanticipated events that leads to death or injury are related to nurse understaffing. And yet we continue to see nurses understaffed at medical facilities. Nurses around the country have identified understaffing as the single most important barrier they face in providing quality care to their patients. It's also a barrier to quality improvement in efforts to reduce preventable readmissions. I've introduced legislation called the Safe Nurse Staffing, Patient Safety and Quality Care Act, which would help solve this serious problem by establishing a federal minimum standard in all hospitals for direct care registered nurse-to-nurse staffing ratios. But this problem is not confined to hospitals. Nursing homes are currently required to only have a direct care nurse on staff 8 hours a day. This simply makes no sense. Patients are in these facilities 24 hours a day and need access to round-the-clock nursing care. That's why I've introduced put a registered nurse in nursing homes in Nursing Home Acts. So we should be thanking nurses who are considered the most ethical of our healthcare system, and I applaud them, and I yield back.